time now that the American people speak. Before the Congress goes back into session, you have to communicate with your elected officials, because these decisions will be made. And these decisions will affect not only us, but our children and our grandchildren. And I believe that this kind of a forum needs to be held all over America so the American people can be heard. I'm grateful you're here tonight. I'm ready to answer any questions or comments that you have. Thank you, and thank you for being part of this important part of the meeting.
Senator, I have a couple of questions for you. One, if government health care is so terrible, why do our veterans have it? Why don't our active duty military have it? And I might add, why do you have it?
Most Americans are satisfied with the health insurance that they have. They do not want to have a government health insurance. So all I can tell you is that I do not believe that the costs that would be borne from a government health insurance system, which I just read to you, when they can get affordable and available health care in other ways, is the answer. What's your second question?
Well, the problem is the people who are satisfied are the people who can get health insurance.
That's why we have to make it affordable and available.
Competition is already there. Unfortunately, it's just like competing against like. Public option is competition. I am satisfied with my health insurance. However,
hi there, Senator. My name is Rick Simon. I've been a journalist for over 40 years. I'd like to tell you why Obama won the election. Maybe you know George Bush Light.
Here, thank you for that information, but do you have a question or a comment about health
No, just a statement.
Why don't I have the health insurance that you've got? Because I'm paying for it, and I'm paying for the President of the United States health insurance and Congress's health insurance. Why don't I have that?
You're exactly right. That's why I want to make health care insurance available and affordable to you, sir. That's my goal, is to make health insurance available and affordable to you. Good.
Mr. Senator, the debt that we have now, my kids won't be able to pay off. What can you do for me and my kid? My dad has taught me to either be part of the problem or be part of the solution. We have the solution.
Yes, thank you very much.
Hi, Senator. My name is Randy Hatch, and I have cast my vote for you every time you have come up for election and trusted you to go back to Washington and do the will of the Arizona people, not the Massachusetts, not the New York people, not the Utah people, but the Arizona people.
Yeah.
And sometimes I feel like you reach across the aisle way too much. A bill that would have proposed amnesty to illegal aliens. And you promised us at that time, 4 years ago, that you would secure and protect our borders. And to this day, you haven't. They're still flooding across the border. How can you give promises that no illegal alien will receive one dime from this health care plan?
Obviously, I make that commitment to you, and that's why I put it up on this board, because 10 million of the 47 million people are people who are in this country illegally. I'm happy to tell you that we are continuing to secure our border. We have not done that, but the number and amount of illegal aliens has dropped significantly. The other is because we have improved the fencing along our border. But let me tell you a big problem that we have, and that we have to work with the Mexicans if possible, and that's the drug cartels. The drug cartels now own parts of Mexico. It's a $16 billion a year business. Those drugs are coming into the United States of America and killing our children. And the violence, as you all know very well, is unprecedented, and the cruelty, beheading people and hanging them from the overpass. And we have to work to stop these drug cartels. Otherwise, you are going to see the government of Mexico fall, and in a way that corruption will have taken over. And by the way, I'm sure you see the articles in the newspaper. Some of that corruption, because there's so much money, is on our side of the border as well. So I think we have to secure our borders because of illegal immigrants. But I'd also tell you that the drug cartel problem is a huge one. And the corruption, unfortunately, reaches up to the highest levels of the Mexican government. We've got to work with them. And one of the reasons why we have to work with them, a lot of those drugs do stop in Mexico. But the majority of the drugs, as you know, the destination is the United States of America. So I commit to you, Randy, that I will continue to do everything I can to secure our borders, not only because of the illegal immigration, but because of the drug cartels. Let me just tell you one experience I had a couple of weeks ago. I was down in Yuma. They discovered, as they do all the time, a tunnel underneath the border. It had cost the drug cartels $1 million to dig that tunnel. What did they care? They're making billions. So it's a huge problem. I commit to you I will continue to work on it, and I thank you for your past support. Yes, ma'am, all the way in the back.
Senator, this is a picture of my granddaughter. She'll be 3 years old on Saturday, and she has cystic fibrosis. There are 30,000 Americans, children and adults, that have cystic fibrosis. You all need to go, and it is time that we pass an amendment to the Constitution to instill term limits for everyone.
Patients since I was 6 years old. I didn't find out until I was 16. So my issue, the first one is with Medicare. I've been on Medicare for about 3 years now, and they do not cover any dental coverage. I've lost 5 teeth because of decay underneath the crowns, and I can't have them removed because I can't afford it off my disability. And they, even as my doctor is saying it's a medical necessity, I have no immune system, and I have decay and infection in my mouth, and they won't remove the teeth. Now, access will remove the teeth, but I've never, my disability income's too high. I've never been eligible for access. And that's my next issue. To me, a simple reform of access program that would accommodate a lot more people is if you're over the $850 limit, I make $1,100, I'm not eligible. And I wasn't for years. I was paying $650 a month for a portability plan, had my house going to foreclosure because I'm trying to keep health insurance. Now, all I have to do is put a sliding scale over the top of that $850, whatever that sliding scale has to be to work fiscally, and get it done. If I pay $350 a month, that's a lot better than $650. Might still be on the